slip it, cuff it, check it. Talk to doctor now and share it. Get it, slip it, cuff it, check it. Talk to doctor now and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Hello and good afternoon, everyone. Thank you for joining us today for the first in the series of the 2022 Check It Community Conversations. I don't know about you, but I know that song's going to be stuck in my head the rest of the day. My name is Stephen Perlin. I am the social media specialist at UHS. We are a large and comprehensive provider of healthcare services in the greater Binghamton area, and I'm very excited to be here today and bring with me a ton of great panelists. The Check It Challenge is an evidence-based wellness and blood pressure management program that focuses on improving your health by making simple changes to prevent and manage high blood pressure over the next 4 months. UHS, United Health Services, is proud to be returning for the sponsor for the Check It Challenge, and especially the new 28 Journey to Better Health Paths to help you achieve your health priorities. These journeys provide you with daily emails and reminders with small tips and nudges to help you make the changes you want, which I know I personally would find very helpful to make me motivated and get me moving. You can choose from managing your blood pressure, eating smart, or moving more. And you can start your journey right at www.heart.org/UHS. Now, and then you can also check out more about the Check It Challenge right at www.heart.org/checkitny. So you can head there and you can get started now. As I mentioned before, United Health Services, UHS, is a proud sponsor of this. I'm very proud to be here as well. And I'd like to thank all of our Check It Challenge sponsors, including CEFCU, Kinney Drugs Foundation, PCSB Bank, Hillrom, and Tompkins Mahopac Bank. Today's Check It Community Conversation, Control Your Blood Pressure, is presented by Kinney Drug Foundation and Hillrom. You're going to hear some amazing speakers, but these are entitled conversations. So it's not just about listening to the panelists. We want to get you ready and set with the chat box by introducing our chat box to start. So what you're going to do, if you can find the chat box at the bottom, you can see a little icon that says chat. Why don't you add your name or company and where you're joining us from today so we can all get to know each other a little bit, and you can get used to using the chat box. This is where you're going to put any questions you have, which we'll use later during our Q&A at the end of the this seminar. And there's a quick reminder here, though. This is a public event, so please avoid disclosing any personal medical information. And now we are also recording this session today, and it will be available on the Check It Challenge website, Facebook event page, and on the YouTube channel. As a reminder, you can access all these materials on the event website, www.heart.org/checkitny. If you are using social media throughout this conversation, make sure you're tagging us, and please use the handles you see on the screen at AHA New York. New York is spelled out, and use the hashtag #CheckIt so that you can be a part of the conversation. All right, now we're ready to get this started. Now that we got all that out of the way, our first speaker today is Dr. Sherry Gurill. Dr. Gurill serves as family medicine physician and medical clinical lead with the Community Health Center of Buffalo, Inc., with primary office hours at the Community Health Center location in Niagara Falls. Dr. Gurill sees a wide range of patients from children to adults, and also supports CHCB's Women Health Services and Family Planning Services practices, seeing women for a wide range of gynecological needs. She attended the Family Medicine Residency Program at the State University of New York at Buffalo, where she was awarded the Erie County Medical Center Excellence Award. Dr. Gurill completed her medical degree at Saba University School of Medicine. Saba is a municipality of the Netherlands. She also holds a Master of Science degree with distinction neuroscience from the University of Toronto, and a Bachelor's of Science degree with distinction biology and psychology, the University of Toronto. She is also fluent in Hebrew and Russian, if you weren't impressed already. And her personal mission statement is, an ounce of prevention is worth a pound of cure. Dr. Grill, thank you so much for joining us today. Now, I just want to say that CHCB is part of the American Heart Association's National Hypertension Control Initiative cohort and a recognized Target BP Silver awardee. Congratulations on those achievements. Let's start out with why we're here today. Why is it so important to be focusing on hypertension? What is so critical about this?
Hi, everyone. First of all, thank you for having me part of this presentation today. I'm very excited to be joining you all. First of all, I just want to give a brief overview about what blood pressure is. We hear about it all the time, but I think it's important to define what blood pressure really is. So if you think about the heart pumping, when the heart beats, it pumps blood into our blood vessels. This creates pressure against the blood vessels, and this helps to bring all the blood that's coming from our heart to all of our body parts. So high blood pressure is what's defined as when the blood pressure coming from the heart to our organs is consistently too high. When we talk about high blood pressure, we also hear a lot about numbers. So we hear 120s over 80s and 130s over 50s. So there's a lot of numbers that we hear. So I think it's important to define kind of what these numbers mean. So the two numbers that we traditionally discuss are the systolic blood pressure, which is technically the top number, and then we hear about so-called bottom number, which is known as diastolic pressure. So let's take these one at a time. The systolic blood pressure is recorded when the heart is pumping blood out of the heart into all the blood vessels into the body. So the pressure that is recorded at this time is called the systolic blood pressure. So for example, you might hear that your systolic blood pressure is 130 or 140. So this is during the active part of the heart pumping. The bottom number is called the diastolic pressure. And this is the number that's reflected when the heart is so-called relaxing. And then this is just a kind of a passive flow of blood through the arteries. So that's called the diastolic. That's the bottom number of blood pressure.
I think that's obviously very important information. I know I wasn't well informed on that, so that's great. I'm sure for our audience to kind of understand a little better. And then as you were talking about these numbers, I mean, people shouldn't be stressing out about them right away when they see it, or that's when you know you have to take action, correct?
Correct. So recording the numbers and getting a good idea of what your number is really important. And that's, obviously part of this Check It challenge to, monitor your blood pressures regularly, especially if you have a history of high blood pressure. The chart that you see on the screen right now breaks it down a little bit more in terms of what's considered a normal blood pressure, and anything less than 120 over 80, meaning a systolic of 120 over a diastolic of 80 is considered normal. So if you went to the doctor and you were told your blood pressure is 100 over 60, you're set. That's a good blood pressure. It's considered normal. It means that there is not too much pressure being exerted on your blood vessels from your heart. There is an extra strain on your heart to provide arteries, blood flowing through the arteries to your organs. Now, the next kind of stage here is the elevated stage, which you see in yellow, and that's between 120 over 129 systolic over less than 80 diastolic. And this kind of moves up through the chart, as you can see. So it moves anywhere from normal, just less than 120 over 80, all the way up to 180 over 120, which is actually considered a medical emergency, and you should be seen by a medical professional right away. A lot of people kind of live in this stage of high blood pressure, which is consistently having blood pressure readings of 140 over 90. And obviously those can fluctuate on a day-to-day, but that's technically what's considered high blood pressure. Anything over 130 over 80 is the definition of hypertension.
I mean, obviously these numbers, we get them. What should your reaction be if you have uncontrolled hypertension? What could this lead to, and what should your first move be? I guess I know you mentioned obviously contacting your provider.
Right, exactly. So first of all, just a quick overview. As you mentioned, high blood pressure does affect millions of people, Americans in the country every day. Just a general statistic is about 47% of all adults have high blood pressure. And we do unfortunately see that people of color are disproportionately affected by high blood pressure due to a variety of different contributing factors, which I'll touch upon a little bit later. But to answer your question, if you do, let's say, go to the pharmacy and see that your blood pressure is elevated, or you've been somewhere and you've been told your blood pressure is elevated, maybe at a screening fair, you should make an appointment to see your healthcare provider to have it rechecked. There are certain conditions that can affect, your blood pressure levels. So, for example, as I mentioned, your race or ethnicity, this is a non-modifiable risk factor that can contribute to high blood pressure. And often African Americans tend to develop levels of high blood pressure earlier in life for a variety of different reasons. There are modifiable risk factors, however, which are things that we can control on a day-to-day basis that contribute to high blood pressure. So the main things are diet and exercise. So, for example, if you are an individual that's perhaps consuming a lot of salt or so-called sodium in your diet, that can definitely lead to high blood pressure. If you're physically inactive, if you're very sedentary in your day-to-day life, that can be contributing to elevated blood pressure. Smoking is one of the big contributing factors, and also drinking alcohol. So these modifiable factors are things that can be, worked on with your healthcare provider, and they can help come up with a plan in terms of how to cut down on these things. A lot of the times people think that they, for example, don't consume a lot of salt in their diet. They tell me they don't add salt to their food, but they're often purchasing foods that are processed and packaged, and those have a lot of hidden sodium levels that need to be cut down on.
Perfect. Yeah, that's perfect. And I got ahead of myself a little bit. We got to find out what causes blood pressure before what it leads to. But I appreciate you catching me up there. So yeah, this obviously is important to catch, and you want to be on top of this. Now, are there more, like, I guess, symptoms or something you should be careful or what you should be watching out for if you're kind of living this lifestyle that might lead to that?
So that's a great question. I think one of the biggest misconceptions is that if you have high blood pressure, you're going to have symptoms. And this is simply not true. And this is one of the scariest things about high blood pressure, is that most people will not experience any symptoms at all. Meaning you could be walking around and have a blood pressure of 150/90 and actually feel very normal. So unfortunately, hypertension is also known as the silent killer, because over periods of time, whether it's months, years, decades, it has very significant and long-term effects on many organs. So when I counsel my patients in the office, I explain to them that having high blood pressure will have effects on your heart, your kidneys, your eyes. And a lot of the times, if these effects are not prevented early on or controlled, they can have long-term effects that are often irreversible. We often see patients, ending up with heart failure because their blood pressure is too high and it's causing increased stress on their heart. It could lead to heart failure. It could lead to stroke, which will be covered in another session later this year, but definitely increasing levels of stroke, with elevated blood pressures throughout the body. So, just because you don't have any symptoms doesn't mean that you're not a victim of high blood pressure. So definitely having your regular screenings with your healthcare provider is important. And that's usually when these things are picked up.
See, and I think that's one of the most important things we can obviously make sure that people walk away with this, is that there are no symptoms. So you're not looking out for any sort of factor or to feel a certain way. You're kind of just monitoring yourself and obviously trying to eat healthy and have a healthy lifestyle that would impact that in every sort of way. Is this one of the reasons why physicians are talking so much about self-monitored blood pressure, just because it is a silent killer and you got to keep an eye on it no matter what?
Absolutely. So self-monitoring is really a great tool that we can implement in our communities. Some patients often will come into the office and they'll have a high blood pressure when they're seeing me. For some people, it's called so-called white coat hypertension, where they're nervous or they're anxious in the office. But then when they're at home, their blood pressure is normal. So being in a comfortable environment, you didn't just get off a shift and you're running to the doctor, or you didn't just get off the bus and running to catch your appointment. So you want to be comfortable, you want to be relaxed, and that's a good time to take the blood pressure. So if you can do that at home and self-monitor, that's very important.
Great. Yeah, that's some important information to know too. Obviously, your doctor is always going to be checking when you come in, but if you could do it on your own time, it's always safe to be rather than sorry in any sort of scenario, especially this. And then as a physician, can you give us your opinion? What is one thing you recommend everyone on the call today to do to work towards blood pressure control?
So really, I would say two things is really diet and exercise. So really just trying to, be more active, whether it means, parking your car a little bit farther away and walking a little bit further to get to where you need to be, or taking the stairs at work. I know that we all have a lot of, demands on a day-to-day basis, and I don't expect any of my patients to be running marathons or, at the gym for an hour every day, but just getting those extra steps in daily, that can definitely help with cardiovascular health. And then cutting down on that excess processed foods and salt makes a big difference.
And one small tip that I could add is often when I go to work and I'm parking, I park a little bit further away to get a couple extra steps as I'm walking in to help kind of, add to my exercise for the day. So that's something somebody else can do too, as long as it's not raining or snowing. I know where I am, that's always kind of the factor that's slowing me down for doing that. I'm parking closer in those scenarios. Well, thank you very much, Dr. Gorilla, for your time today. That was very informative and a lot of great information I hope everybody absorbed. If you have any questions for her, make sure you put them in the chat box for our Q&A session later. We will be watching these questions and we will be saving them for later, so don't worry, they're not going to get ignored. So thank you very much for joining us.
Thank you so much for your time.
And now we're going to move to our next guest, and that is Dr. Shannon Miller. Shannon is the Director of Patient Outcomes and Pharmacy Technology Optimization for Kinney Drugs. Shannon is a clinical pharmacist and diabetes educator who is passionate about making a significant difference in people's lives through innovative, well-thought, and customer-centric services. Shannon, it is great to have you back this year. We just talked about what high blood pressure is and why it is so important to control. Where does the pharmacy fit into all this?
Well, thanks for having me. I am, excited to talk about the pharmacist's role in controlling blood pressure. And maybe it's not something you often think about. I'm sure a lot of our patients think, oh, I can go into the pharmacy and check my blood pressure on, just the machine that's hanging out in the pharmacy. And then maybe that's the extent of it. What they don't know is a lot of times those machines are actually linked into our pharmacy software where we can see the numbers if patients sign up for our programs. But our pharmacists are one of the most accessible healthcare providers, right? If you have a question, you can just pop into your local Kinney or other pharmacy to get your questions answered. And our pharmacists are really adept at answering questions about medications, and they have strategies that help patients stay on their medications. If you're someone who forgets your medications, what are some strategies that you can do to remember taking those medications as prescribed? There's also some common barriers that people may face in taking medications that you don't think of, like being able to afford the medication that's prescribed, drug interactions that may happen. And then just in general, sometimes the medication doesn't make the patient feel very well. So pharmacists can sit down and talk with you about what is the best option for you. Maybe it is recommending a different medication. Maybe it's taking the medication in a different way to avoid the drug interaction or to make you, feel a little bit better after taking the medication. They also have the ability to, develop like a cost saving strategy for you. Maybe it's coupons that are out there, or suggesting a, generic drug instead of a brand drug. So really just stopping in, reviewing your medications as a whole with your pharmacist can help you in controlling your blood pressure.
Yeah, and obviously, as you were just talking about, I mean, clearly the pharmacy does play a big role in controlling your blood pressure. And I know another thing out there is like the GoodRx and all those other apps that help you get discounts and such on medication, which is always helpful. And now one of the things we were talking about with Dr. Gorilla was the fact that high blood pressure, hypertension doesn't really have any signs or symptoms. Which is obviously always alarming. But how do we know the medications we are prescribed and that we're taking from the pharmacy are actually working?
Really, the best way to know is to check your blood pressure at home. And, there are a lot of options. There are some products that are better than others. And I know Susan later will talk to everyone about what those products are. But what you may not know is that some insurance companies will cover an at-home blood pressure monitor. So talking with your HR or talking with your benefits coordinator where you work, you can identify what those products could be. Pharmacists also can help in that process in identifying a product that may work for you, that's easy to use, but also it could be potentially free to use sometimes. So that's good to know, because sometimes that cost can be a barrier for some patients. But checking your blood pressure every day at the same time of day and recording those numbers down is the best way to know if the medication that you're on is working for you. And when you check your blood pressure, you should do it not the second you wake up, give your body a little time to wake up, get into the day, but before that morning cup of coffee or any other caffeine that you take, before you exercise, any of that. And that number will show you apples to apples every day, right? The same number and how the medication is working for you. Keeping a journal, sharing those with your doctor and your pharmacist of that number is a great way so that you can see trends.
And I got a question for you. So obviously we want to do this every day. We wanted to keep things similar. Should you make notes of different circumstances that might be occurring around when you're doing it? Maybe you're stressed out. Maybe you got a bad email for work, stuff like that. Because I assume, as mentioned earlier, I think that plays a factor into it. So it's important to be able to note that from time to time.
Yeah, I think notes like that are really important. If you've strayed from your morning routine, if you're feeling extra stressed out with whatever is going on, just knowing that and seeing how it impacts your blood pressure is certainly helpful. Or even thinking about what you ate the day before, right? I mean, we've all occasionally snuck in the Taco Bell or the whatever meal the day before, and you'll actually be surprised the residual effects of what those choices from the day before actually have on your blood pressure the next day.
Not Taco Bell. Taco Bell, that's fine for you, I'm sure. And obviously, this should go without saying, but one of the more important things you could do is obviously take the medication that you're getting from the pharmacist, because you're not going to get any better unless you are actually taking it and seeing what it can do for you. And then what leads me to kind of my other question here. When taking the blood pressure medication, is there anything we should try to do, like specifically when we're taking it, or at least maybe avoid?
Well, I think one of the most important things when you're prescribed a new blood pressure medication is to actually have patience. So, your body does need time to adjust to the medication. So that may mean, checking your blood pressure each and every day so that you can see if it's working for you. And if it's not, and for many, more than one blood pressure medication is going to be needed to control your blood pressure. And you got to know that that's okay. And, to expect that, but knowing what your numbers are and taking your medication as prescribed every day will help the pharmacist and the doctor make that decision if more than one medication is needed for you. It also can take time to find just the right dose, the combination. Some blood pressure medications your body needs to adjust to. There's one particular type of medication where you may feel tired. And this may take a couple weeks for your body to adjust and come out of. So knowing things like this ahead of time and having the patience to get through those adjustment phases is really important, because for some people, they don't feel at all that they have high blood pressure, but they may feel some initial side effects to a blood pressure medication. And when making a decision, do I want to feel good or do I want to feel bad? You know, just knowing that that adjustment period is a short period of time. And then once you're on the medication, oh, I'm sorry, did you have a question? Once you're on the medication, it's good to make sure that when you're picking any over-the-counter medications, that you know some of the medications to avoid, like anti-inflammatories can raise your blood pressure, nasal decongestants can do the same thing. And then there are other medications that may interact with the blood pressure medication that you're on. So before you just grab anything off the counter, just pop by the pharmacy and, you know, let the pharmacist know what you're on, and they can help you pick the best product for you.
And I think that point about patience is probably one of the best things we can hear today, because I know a lot of times you get on a medication and you're just expecting it to be an instant fix, or you're hoping it's going to be right away. You're going to feel a difference right away. So it is important to be patient, because not everything works right away, unfortunately, in this day and age. I know we're used to that type of instant gratification, but you know, you just got to stick with it. And obviously your doctors know what they're doing. The pharmacists know what they're doing. So they're trying to help you every which way. And another point I just wanted to kind of make is we are taking these medications. Usually your provider would know, I would assume, but if you're going to another provider for any testing, it's important to let them know too, because that can affect other tests depending on what's going on with that medication, I would assume.
Mm-hmm.
All right.
Yeah, it is good to carry your medication list, right? And share with all.
Exactly. Yeah, you want to keep everybody informed. All right. Well, thank you, Shannon. We appreciate we appreciate you being with us today. And now we are heading into our last speaker for the day, our last panelist. Susan Manjacaro is the Medical Affairs Manager at Hillrom, where she leads the frontline care division, serving as the clinical expert ensuring strategic development of clinical evidence. In addition, she's a frontline responder and leader in global emergency response to natural disasters, humanitarian crises, and infectious disease outbreaks. She recently responded to the earthquake in Haiti this past September, and before that responded to the COVID-19 crisis in NYC shortly after the pandemic first hit in April of 2020. Sue, you are returning to our conversation series this year. Welcome back, and thank you for joining us. Last year, you talked a lot about the proper technique when taking a home blood pressure reading. Can we revisit that topic again? And will you walk us through what the average person should be considering when selecting a device for home monitoring? I know all of us aren't experts on that type of stuff, so that's why we have you. So lay it on us. Thank you, Sue.
Perfect. Thank you. And thank you for having me back. It's really an honor to be back here. I want to kind of talk about both of those questions a little bit separately, because, you know, there are so many blood pressure devices available, both at local stores like Targets and Walmart, pharmacies like Kinney, CVS, as well as online. It's mind-boggling. I know when my 9-year-old mom went to purchase her second blood pressure cuff, she called me from the pharmacy and said, "What do I pick?" It's mind-boggling. So I'm going to help kind of walk through the selection process there in a bit. But first, I'd like to talk a little bit about what we talked about last year, and that's how to get an accurate blood pressure with your device. Then I'll share with you one of the most important factors in selecting a device and getting an accurate reading at home, and that is choosing the device. Before I do that, I want to kind of review the steps. They're pretty easy steps and recommendations that are advised on how to get that accurate blood pressure at home with your device. So first and foremost is selecting the right size. We suggest that you try on different size cuffs. Often 2 cuffs may fit, or you think they fit. If they both fit you, we recommend you use the larger one. If you select a cuff that's way too snug or way too big, it could give you a false high or low reading, so an inaccurate reading. Second is to place the cuff on a bare arm. No sweaters, no long sleeves, not even a thin blouse or shirt. That can decrease the accuracy of the reading. So bare arm when you apply the cuff. Next, there's typically an arrow on the blood pressure cuff known as the artery marker. And I'm kind of going to show you something, but I don't want people to get really concerned over this, how to find the brachial artery. I don't know if you can see my arm, but there's an area between your bicep and tricep, kind of dents in your arm. Your brachial artery runs down there. Place the arrow on your blood pressure cuff in this direction. If at all concerned that you can't feel it, don't panic. The suggestion I have is place the arrow in this direction, not over here, not over here, not behind your arm. Place it going down kind of the middle of your arm in where the crease is. That will help increase the accuracy. That cord that runs from the cuff to the device should be on the inner part of your arm, not behind. And next is to be sure that the cuff is applied snugly, allowing no more than room for 2 fingers under the cuff. If you can apply more, it's too loose. If you can't even put a finger under the cuff, it's too tight. Having it applied just right will help increase the accuracy. The next thing has to do with what both Dr. Gorill and our pharmacist Shannon spoke about, and that is to be sure that when you take your blood pressure, try to take it the same time every day. If it's impossible to do in the first thing in the morning, don't do it immediately after exercise, immediately after you just had an argument with your boss or your spouse. Do it after, you've kind of been in a state of equilibrium. Give yourself 5 minutes once you sit down for your blood pressure to stabilize rather than immediately after you sit down. That can cause you to have a false high reading, or right after you stand up, that could help you have a false low reading. So we advise that you sit down quietly, feet on the floor, do not cross your legs. That will change the accuracy. And be sure your back is supported, that you're not trying to hold yourself up. We also suggest that you keep your upper arm at heart level, not way up here, not way down there. Passively support your lower arm so that your lower arm is not dangling. It's recommended that you do not talk. You'll often go into a doctor's office and start talking when they're taking their blood pressure. They're not being rude when they tell you to be quiet, but it does interfere with the ability, A, for the provider to hear, and B, the accuracy. That dramatically can impact the accuracy of the reading. We also suggest that again, besides checking the same time every day, empty your bladder. There's so many environmental factors that can affect your blood pressure: anxiety, pain, physical activity. If the room's way too hot, way too cold, all of those things can impact your blood pressure. And if possible, we know this may be something a little bit difficult to do at times, but check both of your arms. There is a variability often in blood pressure between your right and left arm. It could be as much as 10 millimeters. So we ask that you check both arms and write down right arm, left arm in your documentation. The reason, again, that we're suggesting all of these things is because the most common reason for inaccurate readings, the studies find, are moving, talking, wrong cuff size, taking a blood pressure measurement over clothing, using a cuff that's too loose or too tight. We'll talk about this one in a moment, a blood pressure device that's not calibrated, using the cuff at that's not your arm, not at heart level during that measurement. And if you keep all of these pretty simple tasks in mind and thoughts in mind, using proper technique when you apply the cuff, it will make a difference in getting an accurate blood pressure measurement and in your treatment with blood pressure. I'm going to kind of pivot now over to what is an accurate device? Like, what device should I choose? Again, you go into the pharmacy or look on Amazon. There are so many choices in monitors and devices. And choosing a monitor is very critical in the accuracy, the most critical factor. And we recommend one that has been tested or what we call validated. A validated monitor is one that has been tested very rigorously against standards set by global organizations such as International Organization for Standardization. They're a body that provides global standards for medical devices, both in office and at home devices. It's critically important to select a device that is validated. And you might say, well, how do we know this? Up on the screen now is there's a convenient site called validatebp.org. It will provide you with a list of devices that are validated, and hence those will be devices that will give you an accurate reading. They independently review these devices and determine whether or not it passes the criteria for clinical accuracy. And that list is available on their website. If you have any issues with either getting on the website, understanding what devices you might select from that website, we recommend that you speak with your doctor or your doctor's office or your pharmacist, who can advise you on devices from that list, or if you're not able to get to that list, that would be validated and therefore accurate.
All right, well, that's a lot of great information, Sue. Thank you very much. I think what I found or surprised me, I think, or didn't know, I guess would be my best way to say it, is that the whole talking can affect getting your blood pressure too. Because I know a lot of times you're in a doctor's office, you're kind of, having small talk and stuff like that, but I never even realized that. And even the idea of doing both arms, I would just assume if you're doing it on one, you'd be fine on the other.
Yeah. I mean, it's common to have very similar, but it's not uncommon to have very different. So it's a good idea to document both, to check both. Again, if at all possible. If you're in a rush, probably your blood pressure will be higher, but at least get, that one down daily.
Yeah, it's one of those better safe than sorry type things, like if you can do both and you have the time and you're not too stressed, might as well go for it. As long as you're not rushing, right? Because then that's going to just kill everything as it is. We don't want that. Well, thank you very much, Sue. I appreciate you joining us today. As a reminder, and I should have done this after Shannon as well, and I apologize. If you have any questions, please put them in our chat box, because we want to be able to answer them as we're coming up to our Q&A section or session part of it. So we are going to ask now all our panelists to join us on screen for the Q&A section of this, everybody's favorite part. So we're waiting on our first question and we will go from there.
We have a couple questions related to the two different blood pressure numbers. Essentially, what if one is high and the other is low, or or vice versa? What does that mean?
Dr. Gurilla, you want to tackle this one?
Sure. So that's actually a very good question. And we do often see patients who have isolated systolic, meaning the higher number, or diastolic high blood pressure. It is variable and it really depends on each individual. So I can't really say specifically what each one would mean per individual. The bottom line is that it's something that should be evaluated by your provider. Usually the first step is lifestyle modifications that we've discussed previously, such as diet, exercise, cutting down on smoking. And usually with those, we do see some improvement in one or the other coming down. Oftentimes medication is necessary, even if there is isolated diastolic or systolic high blood pressure. In some people I've seen, if they do have some underlying heart condition, whether it's congenital or some other type of valve problem, that can also lead to isolated diastolic or systolic high blood pressure. But that being said, it's very general. So seeing your healthcare professional, per your specific case and having that evaluated is recommended.
Our
Great,
next
thank
question, can any medications cause high blood pressure?
Shannon, would you like to take that one?
Sure, there are certainly some medications that can cause high blood pressure. We talked about the over-the-counter medications that can lead to that. It's really a very broad question, so it's best if you are having difficulty, getting your blood pressure under control, you take your whole medication list to a pharmacist or a doctor to review if there's anything that could be contributing to that.
and I apologize, there was a specific element asked later for asthma products. Could asthma products cause high blood pressure?
So depending on the medications that you're taking for asthma, the majority are usually going to be medications that you inhale. When you inhale the medication, it's very unlikely that any of the medications will actually impact your blood pressure. Now, if you're someone who is taking oral corticosteroids like prednisone, it is a possibility that that could raise your blood pressure if you're doing it on a consistent chronic basis.
Thank you. Our next question, how low is too low for blood pressure?
Oh, that is probably a very good question. Who would be interested in taking this one? Dr. Grill?
Sure, yeah. So when we talk about how low is too low, the kind of the so-called magic number would be 90/60. So anything that's recorded as less than 90/60 is defined as hypotension. And having low blood pressure can be, just as dangerous at times as having high blood pressure, because that could lead to other complications such as passing out, not having enough blood delivered to all your body parts, which could lead to perfusion problems, especially, if you have kidney problems, you want to make sure that your kidneys are well perfused at all times. So that's why it's important, especially with the self-monitoring, when you are on blood pressure medications, to, do a good job at checking what your blood pressure is. That way, your blood pressure medications can be titrated. We are very lucky that we have lots and lots of different blood pressure medications to choose from. So if one of them is perhaps too high of a dose for you, we can always go up or down on the dose. If one class of medications isn't working, we can always adjust it. So 90/60 is kind of my cutoff. If I'm seeing someone in the office with blood pressure consistently less than 90/60 and they're on blood pressure medications, I'll definitely hold that or scale back, because for some people, they're just sensitive to the medications and they need to be adjusted. Some people might feel some symptoms if they have low blood pressure. They might feel lightheaded, they might feel dizzy, they might feel like they're going to pass out. And if someone is having any symptoms, I definitely recommend checking their blood pressure, whether it's with a cuff at home, or at their local pharmacy, or at their healthcare professional's office.
Our next question is related to checking blood pressure at home. Are wrist cuff blood pressure monitors accurate?
Wrist and finger, I'll take that one.
I saw you already starting, Sue. I figured you had it.
Yeah, wrist and finger devices are not recommended. I know the last time we did this, the same question came up, and what do you do if you have one? Well, if possible, in several insurances do cover blood pressure monitors and devices. If possible, try to obtain a validated blood pressure cuff device monitor versus the cuff and wrist. There are studies that show the accuracy is not there with those devices. So that would be our recommendation.
Also related to taking blood pressure at home. If someone is taking blood pressure medication, is there a time that's best to take the blood pressure reading? For example, if I take my medication in the morning, should I wait until the evening to take my blood pressure?
That's a great question. A lot of times with medications, they ask you to wait a certain amount of time before you do some sort of testing. Sue, do you have an answer to that one?
I think I'm going to bounce that over to Shannon.
Okay, that's fine.
I have an answer, but I want to be sure the expert speaks.
Well, generally we recommend, just the same time at every day. In the morning is best, is what we generally give to our patients before you take your medication, checking your blood pressure in the morning. But if that's not convenient, then just keeping the time of day as consistent as possible and keeping when you take your medication consistent.
So generally, just to follow up, it's best to do it before you take the medication?
Yes.
Okay, that's good to know.
We got a few questions related to blood pressure medication and whether or not you can wean off of it. If numbers are good, can you stop taking medicine? Once you're on blood pressure medication, will you always need to take it, or can you go down to lower doses? So like I said, a few versions of the question of can you ever get off of blood pressure medication?
I can take this one.
I was gonna say, I was looking at one of you.
Yeah, so that's an excellent question. And yes, the short answer is yes, absolutely. Once you're on blood pressure medication, it does not necessarily mean that it's a life sentence. You can definitely see improvements in hypertension, especially if you're being very good about lifestyle modifications and, taking charge, exercising, eating well, cutting down on alcohol and smoking. Definitely you can see improvements. So when I have people follow up in office for hypertension and I'm seeing consistently good readings, I'll actually lower the dose myself and then have them go home and track their blood pressures. And if we're seeing consistently good numbers, we can do a trial period and see how they do. I'm a big proponent on getting patients off of medications that they don't need, especially in our elderly populations. There's a lot of polypharmacy where people get started on medications and years down the line, they come into the office with a whole laundry list of medications and they don't even know why they're on them. So that can be very dangerous. So we really want to always ask why we're on the medication and how can we get off of it. And if we're seeing improvements, definitely a trial off the medication is warranted, but definitely always discuss with your healthcare provider first. I always encourage patients to do that. Sometimes stopping medication on your own is dangerous and can cause other complications. So always talk to your doctor before making those changes.
And I'll just add, we typically don't see that unless there's been some lifestyle changes, commitment to diet and exercise, and that commitment staying, consistent. It's not, high blood pressure isn't something that kind of corrects itself, right? There has to be some other changes throughout the lifestyle, but certainly to mirror Dr. Grill's comments, it is important that you know why you're on the medication and that it's continually reassessed, right? It's not just a set it and forget it type thing. It should always be something that's assessed throughout your lifetime as things change in your life.
Oh, great. Thank you. And I'm hoping that everybody who's watching and here today is going to be making lifestyle changes, getting healthier, eating healthier, moving more after this. I think we gave you enough reasoning to do so. Obviously, we want to avoid high blood pressure. Thank you to all our speakers. You guys are almost off the hook. I have one last thing for you today, but you've been fantastic with a ton of great information. I'd like to ask each speaker to leave us with a call to action, a closing thought, the biggest takeaway that everybody, part of our audience, should take away from today. So I'll start with Dr. Gurill first, and we'll move through everybody else.
Sure. So kind of what you attributed at the beginning of the conversation, my big thing is an ounce of prevention is worth a pound of cure. And I think that really being proactive in our health really can help us with complications down the line. So just, being active, taking those little steps. Rome wasn't built in a day. So doing little things every day will make a big difference in the long run.
Great. And Shannon?
I definitely agree with Dr. Gurill, but if you do get to the point where you are on medications, keeping your pharmacy team and your physician team, well in the loop of any questions that you have. No question is a dumb question, and it's best to take your medication as prescribed, but there are, as we said, some reasons why that may not happen sometimes. And there are different things that we can do to help you. So just keep us in the loop and we can be sure to support you on your journey.
Great. And Sue?
I think I'd like to share with folks just a saying that a good friend of mine always used to have, and that is, instead of limiting your challenges, challenge your limits. Whether it's, walk a block today, walk 2 tomorrow, 3 the next day, eliminate maybe 1 snack today, 1.5 tomorrow. All of those things will contribute to your overall general health and well-being, and that's what it's all about. So thank you again.
Thank you guys for being here. I really appreciate it. And I think that's a great point, kind of to, as I'm starting to wrap up here, it takes one step at a time. It doesn't all have to be done in one day. You're not going to kick high blood pressure tomorrow. You do the small things, it's going to add up and it's going to make your health better and stronger over time. So I think that's a great final point for me to make, and then I'll make a couple of others. But thank you all to our amazing panelists today. We couldn't express how much we appreciate you being here. And thank you to all the sponsors that you see on the screen for making the Check It Challenge possible. Again, thank you to our presenting sponsors today, Kinney Drugs Foundation and Hillrom. And last but not least, thank you to all of you in the audience joining us for this great presentation. And on top of that, for all your great questions. The Q&A was fantastic. And I think we got a lot of extra information out there because of it. Thanks to your questions. So you're a big part of this as well. Now, your registration today, which is very exciting news, not only got you into this, it gets you into a bunch of the other series. It gives you access to our next Check It community conversation on Tuesday, March 23rd at 12 p.m. That one's Eat Smart and Reduce Sodium. It's presented by Tompkins Mahopac Bank. And we hope to see you there. Unfortunately, I don't think I will be moderating, but I'm sure you'll miss me. But it will be another great presentation with a lot of great information that you're not going to want to miss. You can trust me on that one. And make sure you keep checking your blood pressure and let us know how you're doing by tagging the American Heart Association at AHA New York, and that's New York spelled out, on Facebook, Instagram, and Twitter using the hashtag #CheckIt. Once again, thank you everybody for joining us. We hope you got as much out of this as we got putting into it. We had a great time. I'm truly happy to be here and honored to be a part of this. And I hope everybody has a very wonderful afternoon. Thank you again for joining us.